Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 41st lecture on pathology. Today, day 7 of Neoplasm. Dear audience, today's topic is carcinogen. First come to what is carcinogen. The agent that causes neoplasm, either benign or malignant, is known as carcinogen. Agent that causes neoplasm, either benign or malignant, is known as carcinogen. Dear audience, we know neoplasm is an abnormal mass of tissue, growth of which exceeds and is uncoordinated with that of normal tissue and persists in the same excessive manner after the cessation of stimulus that evoke the change. So neoplasm is an abnormal mass, and this abnormal mass on the basis of biological behavior may be benign or may be malignant, and malignant tumor is known as cancer, and cancer may be carcinoma and sarcoma. Whatever may be the neoplasm, either benign or malignant, there are some agents that are associated with the causation of benign or malignant neoplasm. That agents are known as carcinogen. Now come to classification or types of carcinogen. The carcinogen broadly divided into physical carcinogen, chemical carcinogen, and biological agent. So carcinogen may be physical carcinogen, chemical carcinogen, and biological agents. First come to physical carcinogen. The physical carcinogens may be ionizing radiations, like ultraviolet ray of sunlight, like X-ray, gamma ray, particulate radiation, like alpha particle, beta particle, proton, neutron. So ionizing radiations like ultraviolet ray of sunlight, X-ray, gamma ray, particulate radiation like alpha particle, beta particle, proton, neutron. Now come to chemical carcinogen. Chemical carcinogen two types. One is directly acting carcinogen. Directly acting carcinogen like alkylating agents, acylating agents, so chemical carcinogen, directly acting carcinogens, alkylating agents, acylating agents. Indirectly acting carcinogens, indirectly acting carcinogens are aromatic amines, polycyclic hydrocarbons. So indirectly acting carcinogens, aromatic amines, polycyclic hydrocarbons. These are the directly acting carcinogens. These are the indirectly acting carcinogens. Dear audience, what we mean about directly acting carcinogens and indirectly acting carcinogens. First come to directly acting carcinogen. These carcinogens are weak carcinogens. These are weak carcinogens. These carcinogens requires no metabolic activation. Requires no metabolic activation. And this carcinogen may cause neoplasm on direct exposure. Direct exposure may cause neoplasm. These are the characteristics of directly acting carcinogens. Now come to indirectly acting carcinogens. Dear audience, indirectly acting carcinogens are inactive carcinogens. These are inactive carcinogens. It requires metabolic activation. It requires metabolic activation. These carcinogens are also known as procarcinogen or ultimate carcinogens. These carcinogens remain in active form. When it is metabolically activated, it can produce neoplasm. So these are called procarcinogen or ultimate carcinogens. Also known as procarcinogen or ultimate carcinogen. Again, it is inactive carcinogen. It requires metabolic activation. As it requires metabolic activation to cause neoplasm, it is also known as procarcinogen or also called ultimate carcinogen. Now come to biological agents. The biological agents may be virus, bacteria, parasite, fungus, plant. So virus, bacteria, parasite, fungus, plant. These are the biological agents associated with causation of neoplasm. First come to virus. Dear audience, all viruses are not associated with neoplasm. Some viruses, either DNA virus or RNA virus, is associated with neoplasm. The viruses that causes neoplasm, that viruses are known as oncogenic virus. So the viruses associated with oncogenesis, associated with causation of neoplasm, is known as oncogenic virus. Now come to oncogenic viruses. The viruses associated with tumorigenesis, that is associated with oncogenesis, is known as oncogenic virus. Now come to what are the oncogenic viruses that may cause neoplasm. First come to DNA virus. Among the DNA viruses, human papilloma virus, HPV, it may cause squamous cell papilloma in the skin, that is viral wart, and it may cause carcinoma of cervix. HPV causes squamous cell papilloma. It causes carcinoma of cervix. So HPV causes squamous cell papilloma, carcinoma of cervix. Hepatitis B virus, it causes hepatocellular carcinoma. Hepatitis C virus, it causes hepatocellular carcinoma. Now come to Epstein-Barr virus, EBV, Epstein-Barr virus. This virus causes nasopharyngeal carcinoma. Nasopharyngeal carcinoma. NPC. Dear audience, you know nasopharyngeal carcinoma is one of the childhood malignant neoplasm, and this is caused by virus EBV, Epstein-Barr virus. This virus also causes lymphoma, Burkitt's lymphoma. It causes Burkitt's lymphoma. Herpes simplex virus type 2. Herpes simplex virus type 2, it causes carcinoma of cervix. Dear audience, HPV causes carcinoma of cervix. Herpes simplex virus type 2, it also causes carcinoma of cervix. Among these two viruses, most common virus that causes carcinoma of cervix is human papilloma virus. HIV virus, it causes Kaposi's sarcoma. So these are the DNA viruses. Briefly, now come to RNA virus. RNA virus, HTLV, human T-cell leukemia virus. This virus causes leukemia. It causes T-cell leukemia. So these are the RNA and DNA oncogenic viruses briefly. Dear audience, I have told you among the biological agents there is virus, bacteria, parasite, fungus, plant. Now come to bacteria. Helicobacter pylori. Helicobacter pylori, it causes neoplasm of the stomach. It causes gastric neoplasm. Dear audience, if this is the esophagus and this is the stomach, if there is decreased gastric acidity following chronic atrophic gastritis, due to decreased acidity, there is growth of Helicobacter pylori, and this Helicobacter pylori converts the nitrates to nitrosamine, and this nitrosamine is associated with gastric neoplasm. So Helicobacter pylori can produce gastric neoplasm alone as carcinogen, or it may produce gastric neoplasm by converting nitrous to nitrosamine. Parasite, Shamsuzzaman. Shamsuzzaman parasite causes urinary bladder neoplasm. It causes urinary bladder neoplasm. So bacteria Helicobacter pylori causes gastric neoplasm, and parasite Shamsuzzaman causes urinary bladder neoplasm. Now come to fungus. Aspergillus flavus. Aspergillus flavus, it is associated with causation of hepatocellular carcinoma by its toxin. A toxin released from the Aspergillus flavus known as aflatoxin B1. Aflatoxin B1, and this toxin causes hepatocellular carcinoma. Now come to plants. Dear audience, among the plants, nut, betel, these two causes neoplasm of oral cavity, that is carcinoma in oral cavity. Tobacco and products of tobacco. Tobacco and products of tobacco, it may cause neoplasm or carcinoma of the oral cavity and also causes carcinoma of the esophagus. Carcinoma of oral cavity and esophagus. Dear audience, these are the different carcinogens associated with carcinogenesis, associated with the oncogenesis, associated with the tumorigenesis. Again, carcinogen is the agent that causes neoplasm, either benign or malignant. Dear audience, I have told you about the radiation energy like X-ray. On exposure of X-ray, some may develop neoplasm, some may not develop neoplasm. On what factor, it depends. Now come to neoplasm on exposure of X-ray depends on neoplasm on exposure of X-ray or radiation depends on number one, dose of X-ray. It depends upon the dose of X-ray. Duration of exposure. So it depends upon dose of X-ray, depends upon duration of exposure. It depends upon individuality. That is, it depends upon individuality. What it means? It depends upon genetic predispositions. That is, genetic predispositions. Dear audience, again, on exposure of X-ray, some may develop neoplasm, some may not develop neoplasm. Why? Because it depends upon the dose of X-ray. It depends upon duration of exposure of X-ray. It depends upon individuality. That is, it depends upon genetic predisposition. Dear audience, today up to this, I have told you about the carcinogen. These are the agents associated with causation of neoplasm, either benign or malignant. I have told you about the different types of carcinogen, physical carcinogen, chemical carcinogen, biological agents. Today up to this, thanks all.